Hello, and welcome to another episode of Mindset Monday. This is May, the first Monday in May. And what can I say? May is a beautiful month. Every month is beautiful, but May is so beautiful, especially it's the month that we celebrate Mother's Day. It's the month that we celebrate women on a whole, and it's the month that we concentrate on mental awareness. Without the mind in the right place, we're unable to do the things we're supposed to do. We are somewhat crippled in the different things we are supposed to take care of, whether it be trauma, because anything can bring on a mind that is not focused. So someone necessarily don't have to be diagnosed with a mental illness to have mental challenges. Anything can bring it on. Case in point, COVID that we just went through, that was a traumatic time in our life. But this month, we are going to look at how we can take care of our mind, how we can maintain a healthy mind, or how we can help our family members and friends who are going through mental challenges, traumas, how to stay relaxed, how to just be, how to help them to restore that vibrancy, to restore them to that area that they can be themselves, that they can do what they're supposed to do, that they can become confident again. Now, this month of Mindset Monday, we are looking at it in on a different aspect. My first episode for this month, in due season, Merry May, we have a beautiful young lady who will be sharing with us little aspects of mental awareness, how to help our families stay mentally acute, how to help them traverse the mental challenges, and how to help them to become relaxed again. And going forward for the rest of the month, we'll be using different themes to help to relax, to help to bring that mind in focus, and to just be, just relax, just rest, just stay for a while. And in staying, we can use music, and we're going to be using music, whether playing in an instrument or singing a song, or we can use the poetic voices of the guests who will be coming on. But for this afternoon, we have a wonderful lady who will be sharing her expertise on how we can become mentally aware, how we can help others who are going through mental challenges, and how we can be aware of the triggers, because sometimes we are not aware of what can trigger someone who is out of balance a little bit because of things that they have gone through. A simple car accident, though it's not simple, just a sit and run, that can throw someone off balance. It may be simple for me who have not gone through it, but for the person who have gone through it, it can throw them totally off. How can we help? How can we be aware and does not engage in words or situation that will trigger them? How can we help them? How can we restore them back to their regular self? So I am going to invite Abiola this afternoon. She'll be sharing with us a little bit about how we maintain that balance and how we help our family, our friends, even our co-workers maintain that balance the way we deal with them. Hello, Abiola. How are you?
I'm fine. Thank you so much, Miss Miriam, for having me. I'm doing well. How are you doing?
I am very good. I'm even better now that you are here sharing your beautiful smile and you'll be sharing your expertise with us.
Thank you so
Uh,
much.
it's such a wonderful thing when young young and mature have used their skill set in sharing with humanity what God has given them. And I'm so happy that
Mm,
you came on and you're able to do that for us today.
Thank you so much
And
for having me.
I'm just going to ask you to just share a little bit about yourself.
Okay. Well, hi everybody. My name is Abiola Fagbuyi. I am originally from Nigeria. I have been here for quite a while. And my background in the clinical mental health is that I hold a BA in psychology and a master's in clinical mental health. So far, I have also been able to volunteer at the University of Maryland, Capital Region Health, at their domestic violence and sexual assault unit, where we advocate for sexual abusers and I'm sorry, sexual victims, and we make sure that the abusers are they get into it with the government, and that's pretty much my summary.
Awesome. I know you have studied extensively and you graduated just a few days ago.
Yes,
Congratulations for
thank you so
for
much.
staying the course. I know it was hard. I
Yes,
know sometimes you wanted to just end it, but I'm happy you pursued and here you are now sharing with us what you have garnered during those trying times when you were almost throwing in the towels. But congratulations
thank you.
and thank you. Now you are an example for others who are at the brink of stopping. Viewers, you can do it just as Abiola have done, and you can come out on top. Now,
Absolutely.
my first question to you this evening, what specific mental health conditions does um, what specific mental health condition a family may have, and what are some of the key symptoms associated with them?
That's a very good question, Miss Miriam. From my experience, I would say depression and childhood trauma. Basically, some of the key symptoms are persistent sadness, loss of interest, changes in appetite or sleep, fatigue, or feelings of worthlessness. This has been very common, and matter of fact, thought of death is very high in the society now, where people just commit suicide. Childhood trauma such as PTSD, avoidance, and all sort of negative thoughts are also things that people deal with when it comes to mental health.
And I know sometimes there's a connotation that is placed on mental health,
Mhm.
and it doesn't. I know it doesn't have to be someone who is diagnosed with or someone who is locked away in an asylum. It can be any simple thing that throws that person off balance. Now, my next question, what treatment options are available for a relative or a friend, and what approach do you recommend for their care?
That's another good question. For childhood trauma and depression, I would recommend EMDR or TFCBT. To address trauma alongside depression, therapy like CBT, which is the behavioral therapy, and possibly antidepressant medication, which is similarly common in America these days when we go to a psychiatrist, when you're dealing with depression and anxiety and all of that. Mental health issues, the first thing they prescribe to you is antidepressant, which has been seen to help people? Well, some people would say that they have different side effects or different reviews about antidepressant, but majority of the time, the antidepressant has been seen to or heard to be working. It has been working, and people have, I have, at least for me personally, I have not had anyone that had negative effect on antidepressant. So, encouraging healthy lifestyle habits, maybe fostering a supportive environment and practicing self care, they're also vital. One thing about self care is that society basically assume that self care has to be very expensive. It has to be something that you have to invest in financially, like very high. You have to travel around the world and all of that. No, that's not what self care is. Well, it could be part of it, but that's not a major self care. Self care could be as little as taking a long walk by yourself. Self care could be as little as journaling, writing your thoughts down. Self care could be as little as listening to music, not irrelevant music, not music that the lyrics are really bad. No. Motivational music, music that will lift up your soul. Self care could be as little as going to the spa, maybe doing your nails for a woman, maybe doing your hair. Self care could be as hanging out with some of your friends that bring positive vibes to you. It doesn't have to cost that much to, present self care into you. They are very important. So regular monitoring and follow-ups with healthcare providers ensure progress and safety. Now, by saying that, a lot of people when they hear the word therapy, especially in an African community, I am from Nigeria, where we luckily now, as Nigerians, we are now embracing therapy compared to before, compared to where I was coming from. Where I was coming from, nobody wants to hear that something is wrong with you. Nobody wants to hear that you went to a psychiatric home. Nobody wants to hear that you went to therapy. Immediately, they start saying you as a mad person or crazy person. Um, they just judge you. The stigma is what actually drives people quiet. It just makes them quiet, and then it drives people into committing suicide. People don't talk about it. And then they hold back onto these things. They hold back onto their feelings, their thoughts, their everything that has to do with whatever it is that is causing their mental health situation. So once they are able to keep quiet, and then it leads directly to suicide. And then people wonder why, you know, people commit suicide. So going to therapy is very vital. I cannot emphasize on that enough. It is very, very vital. Therapy helps with figuring out what exactly is wrong with you, identifying the mental disorder that you might be dealing with. It could be as childhood trauma, it could be as deep as maybe something that your parent has caused, maybe something that you have caused, or your partner, or something, your children. It could be as very deep as whatever it is you can think of. Therapy is a way to, it's like a tree, it's like a rooted tree that it would help you uproot the major cause of your triggers. That is why. And I know that so many people also depend on friends. It's a good thing to have one or two people that you trust, that you want to share your life with, or you want to share your experience with. But guess what? That same person that you trust and want to share something with also has their own things too that they are dealing with. So at that point, that is where a professional comes in. A professional is not a biased person. They come in, and they come into the rescue. So encouraging your relative or anyone, friends, family to seek specialized therapy and consistent professional support, it helps to facilitate their journey towards recovery and improved well-being.
Awesome. I'm happy you're stressing on that, because what I what my thinking is, if therapy can help first, seek that instead of going to the prescription medication. So, as you explain, once the person is seem a little off off balance, that means they're not performing the way they should, or they feel some way that they are not comfortable with something. seek Seek help, get therapy. With therapy, they'll be able, let me use myself. With therapy, I'll be able to identify, oh, that's the trigger. uh oh yes, that's the trigger. And then they can create uh, a way, or give some ideas how I can deal with it and foster that environment so I can be restored to my normal way of living, or even better, because normal sometimes is with the issue that I'm dealing with. But when it's it's open, or when I'm now aware of what is happening, I will now be able to operate in a better frame of mind, identifying what the triggers are and identifying what was bothering me. Thank you very
Sure.
much.
You're welcome.
I know, as you indicated, music, uh, poetry, those are some of the things that can help an individual go through the different twist of challenges or traumas that they have they are going through. And this is why, for this month, I'm making sure that I'm not only speaking on the different topics of trauma, or the different topics of mental challenges, but to, on a lighter note, share with viewers how music, how poetry can help to alleviate, and not just for people who are going through mental challenges, but also for us who are running every single day, doing things just to make ends meet and not taking care of ourselves. As you alluded to, self care can help to balance that side of work and play. So, play can be a night, an evening listening to poetry. Play can be an evening listening to some good music. Play
Yeah.
can be just a walk in the park. Anything that can help to alleviate the stressors of life, that will also help to balance our mental acuteness.
Sure.
Okay, I think you alluded to this before, but I'm going to ask, how can we create a safe and supportive environment at home, to promote mental well being for a relative, a friend? How can we foster that?
That excuse me, that is another beautiful question. So we can support the relative or people around us that are dealing with depression or any form of mental health issues by providing a non-judgmental environment. I'm going to emphasize on non-judgmental environments, and I'm going to also go back to me saying that I am an African and I know how we are when it comes to judgment. We are very good at, maybe I should not put in a cage of maybe an African thing. I think it's just a people's thing. It's a general people's thing. We judge a lot, and which drives whoever that is going through that mental health challenge at that time to be quiet. Nobody wants to be judged. Let's put ourselves in this person's shoes. Let's put ourselves in the shoe of someone that is dealing with maybe any form of mental health disorder, maybe anxiety, depression, bipolar, whatever it is. And you go ahead and talk to a family member or a friend. And the first thing they say to you, let's say that I have eating disorder. And I go ahead and share with a friend that, oh, I don't know what's going on. I just have eating disorder and all of that. And the first thing she says to me is, yeah, but why won't you stop eating? Or why do you like eating so much? Or something like that. And that alone has put me in that cage where I don't want to discuss my personal issues anymore with anybody, regardless. That alone has put me in that cage where I do not want to trust anybody with my information, with my private life anymore. That alone has put me in a cage where, okay, since nobody's going to help me, then yeah, I might as well continue to eat because that is my coping mechanism. You get what I mean? So basically, by providing a non judgmental, by being empathetic, I think being empathetic is a human thing. So I want to assume that everybody, as an individual, has some sort of empathy in them. Also, actively listening to people's feelings. This also reminds me to say that active list not we need to also understand that it's not everybody that has the gift of listening. It's not everybody that has a gift of active listening. Some people, before you're able to complete a statement, they already say 25 statements. And at that time, you probably excuse me, you probably have lost your brain of thoughts. And excuse me, and you're thinking, yeah, but I came to you to talk to you. And eventually, I can't even remember why I came to you. So it's not for us at the time to get upset with that person. We just need to understand also from the person's point of view as a human being that maybe that's just not where their strength is. Now, this also takes me back to going to a professional. A professional is not just a therapist. A professional, yes, a therapist, a psychiatrist, a clinical psychologist, and all of that. There's a reason why these people went to school to study, to go ahead and study and enlarge their knowledge on mental health. Everything that has to do with mental health. It's not just about the money. It's not just about how much they earn or anything. It's most importantly, it's about the people they serve. They are there to serve you. Use them. They are one of the most important resource anybody would need. Use them. Use your therapist. Use your clinical psychologist. Use your psychiatrist. Use anyone that has any mental health knowledge that has gone to school for this. Use them. That way, you know that yes, excuse me, you know that whatever you're bringing to the table, whatever you're about to share, is confidential. You're able to trust the process. You're able to understand that whatever you're about to share, we have HIPAA. Whatever you're about to share is confidential. And you know for a fact that they will never share anything that you've shared with them with anybody except you consent to it. Compared to just sharing with your friends. Again, as much as we have friends that are not gifted in active listening, we also have friends that are not gifted in active is it actively speaking or not speaking. Some friends, you just share your most important secret with them, and before you know it, you already hear you've heard it from several sources. And why do we want to put ourselves into that kind of pressure? Why not just use a professional? Why not just invest in a profession? The same way we invest as women, the same way we invest in our hair, the same way we invest in our hair products, skin products, clothing, shoes, bags, is the same way we also need to start investing in our mental health. It is worth it. It's one of the best investment you can do to yourself. So I would say that, and also offering reassurance. Again, the only place you can offer reassurance or get a reassurance is from a professional. You cannot get it from your friends. Your friends also have their own things they're dealing with. Your family member, they have a lot of things they're dealing with. Why would a family member that is dealing with all sort of things, maybe their children are misbehaving, maybe their children are also experiencing some traumatic situation, and then you now want to call them, you want to call them and discuss your own matter with them. Not like they don't love or care about you. It's just that they are not, at that time, they are not capable of handling what you're about to present to them. Which still brings me back to use your resources. Just use a professional. Using a professional is not a waste of money. It's just like you just see it as you buy yourself a new hair product or a new skin product or skincare routine or whatsoever you call it. Just invest. And then encourage healthy coping strategies like mindfulness, exercise, creative outlets. It also help people generally to maintain a structured routine and assist with practical tasks when needed. Educating oneself about your condition and available resources also helps. It's one thing for you to be able to acknowledge that, yes, I have depression. Yes, I have childhood trauma. It is another thing for you to be in denial. Some people do have depression, but I don't want to redirect this conversation into religion or Christianity. But as much as I am a Christian and as much as I understand what it means to talk in faith or be positive, you also need to be realistic. If you're dealing with depression, it's okay. There's no shame in that. It's okay to identify it. It's okay to be able to acknowledge it, because once you're able to acknowledge it, then the problem is half solved. So, educating yourself would help you seek more resources. It would help you seek more management skills and coping strategies to knowing how to deal with these episodes when they come. And speaking about episode, depression is one of those mental health illness that comes in episodes. One minute you're very happy, you're extremely happy, and the next day you don't feel like standing up from the bed. You don't feel like getting up from the bed. You don't feel like taking a shower. You don't feel like brushing your teeth. You don't feel like talking to anybody outside. You don't feel like doing anything. And here you were yesterday, you were all out, bubbly, calling friends, texting back, being on social media and all of that. That is how depression creeps in. It comes and go. It comes and go. That's why they call it episodes. So when you're dealing with that, you need to be able to educate yourself on that. So when that comes, you're able to identify that, yes, okay, I think I'm having an episode. Now the question is, what do you do when this episode kicks in? I would advise that you journal your thought. So when this episode kicks in, and you probably you're able to figure out the trigger. What triggered this episode? Was it a phone call from somebody you promised never to speak to again? Was it was it something? Was it food? Was it a drink? Was it scream? It could be anything. Were you watching a show and maybe some domestic violence situation pops up on the show, and it just triggered you? You have to be able to take a step back in order for you to be able to identify how you got there. And once you're able to pick that out, you need to jot it down. Journaling is very important. I know a lot of people don't like writing, and it's okay. We have phones. The same way we're able to go on our phones and go on social media, go on Facebook, Instagram, Twitter, and all the social network, is the same way you can easily go on any app and maybe download journal. We have different free journals that you can download. So you don't have to maybe always find a pen and a paper to write or something. Just pick up your phone immediately, write your thought down, write your trigger down, as with an immediate effect, as you can remember immediately. Write it down. So that is that. And yeah, I already talked about educating yourself and encourage professional help. Yes, I've said that before. Again, I will continue to reinstate it. Professionals are there for a reason. They went to school for this reason, to serve. Use them.
Awesome. And what better way to help ourselves to be aware than May is Mother's Day. For some of us who still have our mothers, for our mothers out there, give yourself that gift. If you have find yourself being triggered or be feeling down and out, give yourself that gift. Sit down with the healthcare professional, sit down with your psychologist, your clinical psychologist, sit down with one of them. I know for the most part, since COVID, a lot of persons who work, they're they're supported by that. It's actually a part of their medical plan. So you have those resources. Make use of it, as Abiola says, and enjoy your life. Because when we have these resources at our fingertip and we don't use them, we are sabotaging ourselves. We have so many things dealing with. We are caregivers, we are doing so many different things. So why not strike the balance? Take care of you. Self-care, that's part of self-care. And for children who can afford, some of some of us may not have that resource in our health plan. Children, pull together and help mom. Since this is Mother's Day, I know men also have those challenges, but since this is the month for women, the month for, so we are centering around, but I know men have those challenges too. But just love on mommy, love on your guardian, find a way to help them. This is building awareness. I noticed mom, she's not operating, her normal self. Let me find out what's happening. Let me see how I can help her and see if you can get her to whoever it is in your family, instead of, stigmatizing. Why? I mean, I'm going in my dialect now. I don't understand. She just off the chart, that sort of thing. Seek help, seek help, and find ways that you can foster in the home, whether nice music, soft music. Once you find out what triggers affect your family, find out how you can alleviate or how you can create that atmosphere in the home that will help to alleviate those triggers. And let me jump to our YouTube chat and see if there are any questions or comments.
Okay.
Dr. Patience says, Queen Miriam and Wunmi, she is congratulating you. She is loving on you.
Oh, thank you.
And Nancy said, hello, Queen Miriam, happy Monday. Uh, Dr. Benny, she said, lots of love. Anne
Thank you.
Marie Waller, she said, self care is very, very wide.
Yeah.
And let me see if there are any questions. Dr. Patience says, educating yourself and accepting your mental status help reduce episodes,
True.
journal, and trigger. She's actually reiterating one of the
Yeah.
points you made.
Okay.
And she also talks about self care. And viewers, for the next couple of weeks, you'll be hearing poetry, you'll be hearing music, you'll be watching some of these local vocalists who will be singing to you, just sharing with you how you can use different things, different talents to comfort the heart of your friends, your relatives who are going through different mental challenges.
Yeah.
And also, who it can help you. Remember, it's the small things that can help to restore you to balance again.
True.
Okay, let me see what's the next question. You already said the role that therapists and counselors play in helping relatives cope with their mental health challenges.
Yes.
You want to just share a little bit more and some of the communities that are available to help with that.
That's a good question. I would say that now we have a lot of um, I don't know if I should call it apps or I don't know. For example, I've heard so much about BetterHelp. BetterHelp is one of the is it website, or it's one of it's one of the app that you can, go to. There's therapy. There's a lot of them right now. I don't have a list, but there's a lot of them right now that you're able to, if you don't want to. And then to okay, so let me take that back to telehealth. A lot of people, because of our schedule, we're not able to go into the office to see our therapist or to see our mental health counselor. So I think this is where BetterHelp and other form of telehealth services comes in. They're able to provide you any help that you desire, that you seek. There are charges. There are also insurance based. They are able to accept your insurance. Again, I really don't know much about what insurance they accept, or if you have the insurance that they are able to accept, or whatsoever about the insurance right now. But I do know that there are a lot of them out there that are willing to help, and they've been helpful. Especially BetterHelp, Talk Therapy, and there's also one that is going viral now. That people just all you just have to do is sign up. They would they would match you with a therapist, and the good thing is you're able to test your therapist first. By testing your therapist, it means they'll give you one or two sessions with your therapist. If you do not vibe, or for lack of better word, if you did not connect with your therapist, they would change it for you. They'll change your therapist for you. And may I also emphasize on connecting with your therapist? I think that's where a lot of us also miss it. It's okay to change therapists if you do not connect. So in the so let me just bring a little foundation of a counselor or a therapist to you. So for we have specialties just like doctors do. So we have some therapists, we have some counselors they are specialized in maybe trauma informed care. It could be family therapy. It could be what's it called? Depression, anxiety, and we have all sort of specialties. You can so if you are dealing, for example, you're dealing with maybe a relationship issue, and you and your spouse decided to go see a therapist. Both of you cannot go to a trauma informed care therapist. You have to go to a therapist that is specialized in couples therapy, in couples counseling. So you have to know who to go to. You have to know. So it's important for you to shop around when you're seeking a therapist. You have to know who can connect with what you're bringing in. You have to. It's very important. And also, we also have some therapists that are specialized in a lot of the specialties. We have some family therapy that also uses DBT, CBT, or the what's it called? That also uses they also specialize in trauma informed care and anxiety. They help with all sort of things. It's okay as long as you are able to know that this therapist of mine, this is able to help me. Again, it's okay for you to change therapists. If you do not connect with your therapist, please feel free to change your therapist, because the most important thing is you want to firstly connect with your therapist. Secondly, once you're able to connect, then that's where the trust start coming in. That's where you're able to relax and express yourself. That's how your therapist is able to help you find your triggers, acknowledge your triggers, and start working. And then they build treatment plans for you. And then from treatment plans, they talk about your I think the first thing is to figure out your psychosocial assessment, which is where they get all your history, your mental history, from family, from both sides of your parents, yourself, if you're married, your spouse, and everything. They gather all those information to be able to help them in knowing how to diagnose you, or to be able to help them form a treatment plan that would work just for you.
Oh, powerful. I have a question Dr. Derek. He says, Are there, first, he congratulate you for your achievements, Abiola.
Oh,
And
thank
then
you
he
so much.
asked, are there any steps taken to remove the stigma that people will be more comfortable to go to a psychologist?
That is a very good question. To be honest with you, I would not be able to 100% say yes, there are. But I do know that we're working tirelessly. Now, people are talking more about mental health awareness. People are now being aware that there is something called mental health issues, which is a very big step. Um, if we go back to 10, 5, 10, 15 years, we would realize that we've actually gone far when it comes to mental health awareness. Back then, back 10 years ago, 15 years ago, 20 years ago, we probably don't even want to know. We probably don't even want to hear that there's something called mental health. And even if we do, automatically we think that the person has gone crazy or the person cannot be seen in the society and all of that. But now, people are being aware. There's so much going on. There's so much awareness. When you go to so I reside in the DMV. when where so okay, I'm sorry guys. So first thing, I think I mentioned that I work at the university. I also volunteer at the University of Maryland, at the DVSAC. So what I have also seen there is that even though I am in a department where that focuses on sexual assault, I have seen several situations where, when you go out from the hospital, you see banners of mental health awareness. You see a banner or a flag that says depression is real and all of that. I don't know if you guys also see that, but I do. And for me, that is a big deal. That is a form of way for me to reinstate in my mind that yes, people are now seeing and hearing that actually this is actually a thing. This is actually existing. This is actually something that people are dealing with. Now, I cannot say that the stigma will disappear tomorrow, but the fact that we're even one step ahead based from when we're coming from, I think it's a big win. Maybe one day we'll get to where we're able to handle the stigma. People are able to come out and say, hey, this is what I'm dealing with. This is what it is. And nobody's going to look at you like you're crazy or something's wrong with you or something. People are able to have that conversation that, hey, oh my God, I'm so sorry you're dealing with that. So how do you feel now and all of that? One day and very soon we're going to get there. But for now, the awareness is it really makes me happy that people are now aware.
Powerful, powerful. Uh, Dr. Patience says, thanks for addressing this important topic. Um, is it's about time for us to start recognizing that mental health is important and stop that stigma.
Yeah.
Dr. Benny says also, thank you for educating us on the mental health challenges. Uh, as you were speaking, I realized that, yes, years ago, all we, especially in our African American community, we'd hear that, you know who's gone mad?
Yeah.
And then the ripple of talk among each other, it will go on and on and on, and now the awareness has heightened, so we are more cognizant of people's feelings
Yeah.
and try to find ways of how to manage the triggers or how to help them manage the triggers. And it is so important that we create the atmosphere in our homes, in our environment, create the atmosphere wherever we are in the surroundings that we can help each other. Because it's not if it's going to happen to me, it's when. Because
Mm.
anything can trigger
Yeah.
anything, be it the loss of a loved one, be it the loss of a relationship, anything. Look at what happened during COVID. because of the
Mm.
uncertainty. Uh,
Yes.
as humans, we change is something that frightens us, and anything can cause change. Anything that can cause an upset in our mind. And so it is so important for us to be aware that we can help each other. Uh, sometimes I just looking, thinking about, I'm going way back now in the Bible days where Saul, the Bible talk about Saul, um, when the evil spirit comes over him. I think he had a mental issue, and David came with the harp and he played so skillfully, and it helped him to relax.
Yes.
So this is what I want to foster with us now that we are aware that these situations are there. Now that we are aware that these triggers can come anytime, it's so important that we find a way how to create that atmosphere. That for me, a song. And sometimes in our pursuit to help the person, we may want to sing when that person said, listen, I just need quietness. That is
Mm.
also helping, because a song can be a trigger too.
True.
Like me, I love to sing, and I would come in the room and I'm singing, 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 and the person would say, Miriam, could you be quiet? Now
Mm.
it's so important that we just be aware and don't take it personal. But
Mm.
maybe that's the way that the person could come out and say, listen, I don't want to hear any noise. It
Mm.
may sound rude, but maybe that's all they can say at that time.
At that time.
So being aware of where we are, instead of just thinking about my well-being or thinking about myself, let's open our mind to think about the other person, think about our family member, and know that it's not everything that calms me calm the other person.
True.
Let's find out what are their triggers. Let's find out how we can help them to reduce the triggers, and we'll have a balanced home, we'll have a balanced environment, we will have a balanced life.
Yeah.
It goes right back to when the Lord said, love the Lord thy God with all thy heart, thy mind, thy soul, and thy neighbor in the same degree you love yourself.
Yourself. Mm.
So you want to be happy, or you're happy, you're excited. How can I help the other person to be happy?
Mm.
Although happiness is let's do joyful.
Yeah.
How can I create the atmosphere for joy for that person? How can I create the atmosphere that I am not one of the triggers?
Mm. Wow.
So important.
Yeah.
So important.
Mm.
Now, can you as we're wrapping up, can you just in a summary just share anything else that you want us to hear from your beautiful skills that you have given to us today?
Okay. So you mentioned something that just stuck with me now, which is how do we make sure that we are also not a trigger? Hmm. That is a very important question that we also need to ask ourselves. As much as we want to be there for people, as much as we want to love and care for people's mind, as much as we want to be present, we also want to make sure that we're not the reason that person is going through that mental health challenge. And in summary, I would say that being mindful is a very important skill life skill that we do not learn from school. We do not learn from, I would say that you have to be intentional about that. It's not something that you learn from books. It's something that you have to sit yourself down and be very intentional. Be intentional that, yes, I want to be mindful. I, with your words, with your actions, with everything that we do. Some people, it's just words that triggers them. Some people, I've had some experiences as a child where, as far as I can remember, where there are some words that when I do hear now, as a grown up, as a grown woman, that still triggers me. And I'll give you an example. When I was very, very, very young, I would say I was between the age of 5 and 10. um, I've had some family member call me. So in my language, it's like, so in my language it's iwo, which is you. And I always wonder, why can't you call me by my name? What is wrong with you referring to me as my name? You call every other person by their names. What is wrong? What is the problem with me when it gets to my turn, that you automatically omit my name and then you change it to you? And what amazes me the most is the fact that the same energy in using to call you could have used the same energy to call my name at once. So, as a grown woman, when somebody, random person or a friend, just call me you without having any ill feeling or anything in mind, I get triggered. And it just reminds me, it takes me back to me as a child. And I just get irritated. And the fear of asking the person not to call me that again comes in. And then I'm thinking, what if I say that, hey, don't call me that, and then whoever it is to say, yeah, but that was just a joke and all of that, and you're too sensitive, and you know how it is, and then it just goes on and on and on. And I don't want anyone labeling me as being sensitive, because you don't know my story, you don't know where I'm coming from. So at the end of the day, you get quiet, you don't talk about it, you let it go, you let it slide. To what end, to what extent? So it just brings me back to, let's be mindful. I would say being mindful of our words, our actions, because you just never know what you will do that would trigger someone. You never know what you will say. You never know what you will sing. You never know how you behave that would trigger that person. And because we also don't know what journey this person have been through, you don't know where they're coming from. Yeah, they might be our best friends, they might be our closest friends, they might be our family members, they might be our colleagues, co-workers, students, and everything. But do we actually truly know their journey? There's still some journey that people still don't share. Do we actually know their journey? So basically, I would say, let's be mindful. Let's be mindful. Let's treat people the way we want to be treated. Let's treat people, let's give people the same treatment we would love them to give us. And then so my last time advice is that we are able to wake up in the morning and choose between, do we want to actually be a trigger to someone, or do we want to be a solution to someone, which falls back to us being mindful.
Powerful. Be mindful. And being mindful is being intentional.
Yes.
And once we are coming from the space of loving ourselves, I find that if we really love ourselves, we start asking ourselves the question, would I like that for myself? And
Yes.
then we, Miriam, being intentional, let me hold that, because that may trigger. If that did not sit well with me, it may not sit well with that person. So
True.
loving myself and being aware of what triggers me, then I'll be able to hold that space for that person. Just thinking of holding that space I'm going to use an analogy as a nice placemat. The the food is served and we're sitting to eat. However, that placemat or the charger, beautiful, nice charger, gives the food such a lovely, appetizing aroma, if you might say. So, if we are that lovely charger on that plate, it will help the meal to be more palatable. So, being mindful, being intentional about what we do. Even if, as Miriam loved to sing, and the person said, Miriam, please be respectful of what that person need at that time. Maybe quietness is what helps them to relax. And Miriam come in the room with her bubbly self. Miriam, quiet. But
Mm.
whatever it is, let us be that lovely charger on that meal, that lovely placemat that we can help to create that atmosphere for our loved ones to thrive, to be restored back to balance. And as Abiola says, journaling for those of us who are going through things, and journaling, as I alluded to in earlier months, starting of this year, journaling helps to see where we veer off. We are okay, and once we journal, we'll find that something actually triggers me. Let me see what it is. And then if there's a need to go to a therapist, you will be able to identify, this is what is happening. This is, and 90% of the time, there may not be any need for prescription drugs. It's just to be reminded, just to for us to come back to balance by identifying the triggers. Now, I am elated for how you have served us this evening with your expertise.
It's
And
my
thank you
pleasure.
so much for what you have given to us.
You're welcome.
It's always a pleasure when we have skills that we can use. Now, I'm not skilled in that. I'm an accountant, I'm an enroll agent. So I am dumb to that aspect of life, but we are all here to complement the gifts that God has given to us. And you have come to share your expertise, and I am eternally grateful. Thank you so much.
You're
And
welcome.
we'll be
It's my
calling on you
pleasure.
again. And viewers, next week you will hear of songs, poetry, and how we'll use these areas to help to create the atmosphere. Especially this month, we are looking at Mother's Day. We
Yeah.
are looking at women. We are looking at mental awareness. And so we're going to use this month to share with our viewers, to share how we can use different talents to create that atmosphere to relax, to help our to relax our mind, to restore our mind back to balance so we can become the humanitarian, we can become that person that God has created. And we will see you next week as we share with you how we can use different things to create that lovely mindset again. So, this is Miriam Edwards for another episode of Mindset Monday. Thank you.
Thank you, everyone.